A medical assistant is preparing to perform a suture removal, and which of the following actions should the assistant take first? So just so we could have an idea of how we're visualizing this with the sutures, let's just say that this is an area on the skin where, let's say this was a incision or a cut that needed to be sutured up. And let's just draw how these sutures might look. Maybe it looks like this. And let's just say there's a knot at the end there. Okay, so now let's look at the choices. So option A says to ensure that the wound is fully healed before proceeding. And this would make sense because if, let's say that this wound here was not healed and it was like really more open like this, then when you remove all the sutures from there, then it might stay open, it might not actually be closed properly, it might be bleeding, and then you would need to be suturing it all over again. So that is an important point to make. And the medical assistant, if you notice that it looks like it's still open, which really the provider would be doing this before instructing you to remove it. But if this is something that you know, then you would let the provider know so they can know that, oh, it's not time yet to remove the sutures, or maybe something else needs to be done. So option A is looking good, but let's take a look at the rest of the choices. Option B says remove the sutures in the order that they were placed. And this might not really be necessary. You might have your own style of how you remove the sutures, and also you might not really know which way they were placed. So we can eliminate option B. Option C says clean the area with an alcohol swab after removal. And this would be something you would do before. If you take out the sutures and then clean it afterward, that might sting a bit because then you have kind of a sensitive area after you took the sutures out. So we'll eliminate option C. And then option D says to cut the suture on the side with the knot. So that's saying that if you have this knot right here, that you should be moving this knot through and through every time you take the suture out. And that wouldn't be a good technique because that could do damage to the skin, and that would be uncomfortable if you have this knot going through and through each time you move the suture. Instead, you should be moving this part in and out so that you don't have a knot that's going through the skin each time you take a suture out. So we'll eliminate option D. And then that leaves option A. Ensure the wound is fully healed before proceeding is correct.